Good day, friends, and a warm welcome to the 45th episode of 4D Detailed Discussion and Dialogue in Diabetes, in Indian Diabetes. Over the past nearly 1 year or so, we've been working to understand why diabetes is such a big problem in our country. We've also understood the challenges and we've tried to explore solutions, how we can move from becoming the diabetes capital to the diabetes care capital of the world. In this episode, in the 45th episode, we have with us Dr. Senthil Kumar from Tindivanam in Pondicherry. Warm welcome, Dr. Senthil.
Thank you, sir. Thank you for the introduction, sir.
Now, Dr. Senthil Kumar, Pondicherry is famous for many things in the world.
Yes.
Some good things, some not so good things.
Yes.
It is famous for good metabolic health, and it is also famous for determinants of metabolic health.
Yes.
So, when you go out of Pondicherry, out of your UT, let us say you go out to Tamil Nadu, do your colleagues and friends tease you for anything? Are you teased for anything regarding Pondicherry?
Yes, sir. Mostly the Pondicherry means mostly they'll be teasing, sir, because many alcohol shops like this will be there. So most of the patients living in Pondicherry are most like a pre-diabetic stage they are going, sir. Because recently also one paper published showed that the pre-diabetic the population in Pondicherry is very much higher, sir, as compared to as. Yeah.
So, but don't feel lonely, don't feel alone, Dr. Senthil Kumar, because I'm from Haryana and we also get teased for exactly the same things that Pondicherry is teased for.
Yes,
but in today's topic, we'll speak about uncontrolled, undiagnosed, uncontrolled. Why is it that India is the diabetes capital of the world? So, warm welcome, Dr. Senthil, and we look forward to listening from you.
Okay, sir. Thank you, sir. Thank you very much, sir.
Thanks.
So, I welcome you all for the today's webinar that is hosted by Sun Pharma, and I also especially thanks Dr. Sanjay Kalwa sir for his participation. So today's talk, so basically I am Dr. Senthil Kumar, consultant physician and diabetologist working in Pondicherry and Dindivanam. The Dindivanam is in Tamil Nadu. So previously I worked as a professor of medicine in Melmaruthu Medical College near Chennai. So now I am practicing mostly like the general practice and diabetologist in Pondicherry and Dindivanam. So I have finished MD General Medicine in the year of 2018 and I have experience of around 13 years of experience. So I finished both MBBS and MD in the Chidambaram Annamalai University, that is Rajamuthiya Medical College. And I am now currently working as a diabetologist and general physician in Dindivanam and Pondicherry. So I once again welcome all for the today's webinar. It is hosted by Sun Pharma. So today's topic will be about the undiagnosed, uncontrolled. That is the reason why India is diabetes capital of the world. So as you all know, the scenario of diabetes in India, that is in India, 1 in 11 adults, that is roughly 90 million are living with diabetes. So over 1 in 2 adults, that is 53.1% living with diabetes are mostly undiagnosed. So as you all know, diabetes control is measured as a fasting blood sugar, postprandial, and another important thing is the glycemic. So HbA1c is considered as the gold standard as it directly correlates with the complication that is related to diabetes. So the number of people with diabetes in India is the second highest in the world. So 40 million adults in India have impaired glucose tolerance, which places them at a high risk of developing type 2 diabetes in the future. So the rise in the number of people with type 2 diabetes is driven by many important things, many factors. That is, first thing is the socioeconomic, demographic, environmental factors, and genetic factors. So other contribution that leads to increased number of diabetic population in India is mostly due to reduction in the physical activity, increased availability of processed food, the aging populations, obesity and overweight, and perception of diabetes. So all this can lead to the increased number of diabetic population, particularly in the Indian populations. So in a joint survey conducted by the Indian Council of Medical Research and the National Center for Disease Informatics and Research showed that the number of diabetic cases in India is projected to roughly around 69.9 million by the end of 2025. So as you all know, the many important clinical trials have clearly shown that the bringing down the HbA1c level itself can reduce the complications that is related to diabetes. So the major trials like DCCT trial have shown that even when the HbA1c level was comparable, the risk of progression of complications were greater in the conventionally treated patients. That is compared to the intensively treated patients. The main reason is whenever a patient is having even a controlled HbA1c, the target level of HbA1c level, the patients may have even a glycemic variability. So this glycemic variability also can leads to most important fluctuations, that is glucose fluctuation, either a hyperglycemia or hypoglycemia, that can lead to the patients to major complications that is related to diabetes. Achieving and maintaining the glycemic control in a patients with diabetes is of paramount importance to their overall health and survival. So, however, patients with diabetes often struggle to achieve the target level of HbA1c level because of the majority of the main reasons. So, one of the most common cause for uncontrolled, that is uncontrolled the sugar level, is lack of general awareness about diabetes and its complications. So most of the patients in Indian population are not well aware about the complications that is related to diabetes. So it is very much necessary to counsel the patients about the importance of diabetes and the complications that is related to diabetes, either hyperglycemia, that is a hyperglycemia or hypoglycemia. So one main important thing is generally counseling the patients about the awareness of diabetes and its complications. Next thing is the lack of accessibility to diagnostic measures and treatment of diabetes, especially in the remote area. So, as compared to the Western populations, the Indian population patients, the diabetes is very most commonly diagnosed in a very later stage. The main reason for the diagnosed uncontrolled diabetes or undiagnosed diabetes in Indian population is there is no proper screening method. So basically, important screening methods to diagnose diabetes in the earlier stage is very important to prevent the complication that is related to diabetes. And next thing is the economic divide between urban and rural settings. Next is the scarcity of qualified healthcare professionals and financial constraints of people living in a low socioeconomic status and social barriers. So all these can lead to uncontrolled or not able to achieve a target level of HbA1c level. So now coming to the diabetes that is related to rural versus urban populations. So a report released by the Lancet in the year of 2017 stated that in India that the prevalence of diabetes was almost double in the urban population as compared to the rural populations. So there are many reasons why the diabetes is more common in the urban population as compared to the rural population, because mostly the persons in the peoples in the urban population have a sedentary lifestyles, and the eating unhealthy food, that is processed food, also may leads to increased number of patients in the urban population as compared to the rural population. Next is the Lancet study further highlighted that in urban areas, the prevalence of diabetes was very much higher in the individuals of lower social economic status patients. So this was attributed to the increasing availability of fast, relatively cheap foods in the recent years, which mean proper diets are easily found across all income brackets. So main important thing that is the increased number of diabetic population in the urban population is mostly due to the unhealthy diet or unhealthy lifestyle practices or sedentary lifestyle. So now coming to the underdiagnosed cases due to lack of awareness. So in this slide, you can clearly see, according to the Improve Controlled India study, only 19% of the patients were advised to test HbA1c levels routinely, because majority of the patients were not well aware about the importance of HbA1c level. So only out of which one third of the patients included in the study were aware of the HbA1c test. So only 33% of the patients were well aware about the HbA1c levels and the importance of HbA1c level, and the remaining 67% of the patients were not aware about HbA1c test. So that is why the importance of HbA1c testing in India is very much lesser as compared to testing the postprandial glucose level, testing that other comorbid conditions like a management of lipid managements. So the advice of for testing the fasting and postprandial was given to 97 to 96% of the patients respectively. Although HbA1c level was considered as an important parameters in the diabetic management, the emphasis of this test while making the patient understand the importance of various tests was very much low as compared to other testing. So that is why it is very important to counsel the patient about the importance of the HbA1c test, because HbA1c, as I told, the UKPDS trial clearly showed that every single percent reduction in the HbA1c level can bring down the complications that is related to the either microvascular or macrovascular complications. So that is why HbA1c test is considered as a gold standard test for treating the complications and treating the stable status of the patients about the fasting blood pressure level. So now coming to how to manage diabetes, particularly in Indian population patients. So first thing is a lifestyle modification, that is proper diet and regular exercise. So you should normally, so as I told earlier, the management of diabetes is like a pendant. So you should bring down the fasting blood sugar level, bring down the post-prandial sugar level. You should also achieve the target level of HbA1c level. And another important thing is the glycemic variability, managing the glycemic variability. Because as you all know, the Indian population patients, particularly South Indian patients, take a large amount of carbohydrate intake, and for this patient there is a higher chance of patient going for glycemic excursions. So that is why the patient's HbA1c level will not be under control, particularly in the South Asian, South Indian patients. So proper diet and regular exercise, keep an eye on blood sugar levels, be regular with medications, control the other conditions, other comorbid conditions like control the cholesterol levels, take care of the kidney functions, maintaining the proper weight, and practicing a good oral hygiene. So diabetic management is like lifestyle modification like a regular exercise and yoga, balanced nutrition diet. That is, patient should take a large proportion of proteins and fiber intake and reduce the amount of carbohydrate intake. So that is why it is very much important. That is, first thing is the diet management and regular exercise. Next is the carbohydrate counting and regular monitoring of the glucose. And last, finally, comes the medications. So now coming to the treatment strategies for diabetic patients. So as I told earlier, the earlier intensification therapy, that is, earlier intensified therapy for treating the diabetes can bring down the both the microvascular and macrovascular complications. So this was clearly evidenced as shown in many important clinical trials like DCC trial and EQPD trial. So earlier initiation of combination therapy. So it is an approach to achieve glycemic goals earlier and delay the deterioration of glycemic control, and with possible better preservation of the beta cell functions. So as you all know, whenever we diagnose a patient with diabetes, already 50% of the beta cell function has gone. So the remaining 50% of the beta cell function should be preserved for better control of the diabetes. So that is why earlier initiation of combination therapy is very much essential in the treatment of diabetic populations. So novel medication therapy. So there are many drugs, oral hypoglycemic drugs available for the treatment of diabetes. So these drugs are used along with diet and exercise to control the higher blood sugar level in adult patients with diabetes. So these are, one thing is the DB4 inhibitors. So examples like sitagliptin, saxagliptin, linagliptin, and alogliptin. Next comes the SGLT2 inhibitors like canagliflozin, dapagliflozin, and empagliflozin. And third is the GLP-1 receptor antagonist, like that is glucagon like peptide receptor antagonist that regulate and restore the incretin functions. So these are the novel medication therapy used as an adjuvant therapy for the diet and exercise. So now coming to the important thing, that is a combination, that is a fixed dose combination therapy. So as you told earlier, whenever you're starting a patient with a fixed dose combination therapy, first thing is it improves the patient complaints. So whenever a patient is having a diabetes, they may have other comorbid conditions like either a hypertension or coronary artery disease or dyslipidemia, and patient may be taking many drugs. So to reduce the pill burden of the patient, we can directly start a fixed dose combination therapy. So that will bring down the improve the patient complaints and also can bring down the target level of HbA1c level. So here comes the fixed dose combination therapy of combination of SGLT2 inhibitors along with DP4 inhibitors for a tight control of blood sugar level. So as you all know, SGLT2 inhibitors directly act at the kidney. It increases the glycosuria and decreases the glucose toxicity. And another important thing in the SGLT2 inhibitor is it reduces the body weight, and it also has a other pleiotropic effects like it reduces the systolic blood pressure. So the SGLT inhibitors have other pleiotropic effects on the pancreas. So it has indirect pancreatic effect, that is, it increases the beta cell sensitivity, it increases the counter regulatory hormone like glucagon. So these are the additional benefits of SGLT inhibitors. Now coming to the DP4 inhibitors, it directly acts at the intestine level. It increases the incretin effects by increasing the GLP-1 and GIP, gastrointestinal peptide. So this drug is weight neutral. So one thing is SGLT reduces the weight, body weight, and DP4 inhibitors is a weight neutral. So SGLT DP4 inhibitors also has additional pleiotropic effects on the pancreas. It has a dual pancreatic effect. That is, one thing is it increases the insulin secretion. It decreases the glucagon secretions. So these are additional benefits of different. So whenever we are combining These two novel drugs, that is SGLT inhibitors along with DPP4 inhibitors, there is a better chance of achieving the target level of HbA1c level, and it also has less side effect as using as a monotherapy. So whenever you are combining SGL inhibitors along with DPP inhibitors, there is a lesser chance of patient going for any side effects like a your urine tract infections. So these are very much lesser when you are combining SGLT along with DPP inhibitors. So finally, the fixed dose combination of SGLT inhibitors along with DPP inhibitors is a suitable option for a type 2 diabetic patients because of the following reasons. So one thing is that it is safer, rapid, and has a sustained glycemic control. So whenever you are combining SGL inhibitors along with DPP inhibitors, it is very much safer. It has a very much lesser side effects as used as a monotherapy. It also has a sustained glycemic control, and there is a very less chances of patient going for hypoglycemia whenever using a combination therapy of SGL inhibitors along with DPP inhibitors. So next thing is it improves the insulin resistance and preserves the beta cell function. It also improves the beta cell functions. So these are added benefits of combination of SGLT2 along with DIP4. So it increases insulin resistance and also improves the beta cell function. Next important thing is that it helps to reduce the body weight of the patients and also reduces the blood pressure. That is mainly the systolic blood pressure. So these are additional benefits of SGL inhibitors along with DIP inhibitors. And main important thing is that it reduces the pill burden. So as I told earlier, most of the patients living with diabetes may have other comorbid conditions like dyslipidemia, coronary heart disease, uncontrolled hypertension, or hypothyroidism. So patient may have many pills, or patient will be already in the polypharmacy. So for reducing the pill burden while using a fixed dose combination therapy, it improves the patient's adherence to the drugs and also improves the patient complaints. And finally, it is overall cost effective. So whenever you are combining SCL inhibitors along with DP4 inhibitors, it reduces the cost effectiveness of the patient also.
Thank you, Dr. Senthil Kumar. A wonderful talk, and you've laid bare all the various challenges that we face in our country.
Yes, sir.
One question coming from the audience is, how can we motivate family members of patients? Now,
Yes,
the
sir.
patient who has diabetes, he already has diabetes, right? She has
Yes, sir.
diabetes. But how can we motivate their family members and friends to get themselves tested at regular intervals? So, any best practices from your OPD? How do you motivate their family members?
Yes, sir. So, because as you all know, the diabetes is often very oftenly diagnosed very late in Indian population, sir. Because the screening methods and the patient's education about diabetes is very much lesser as compared to Western population. So mostly we will encourage the patients, attenders, or family members to regularly screen their diabetes because, as you all know, that rather than checking the fasting and postprandial blood sugar level, the HbA1c level is very much important for screening the diabetes and also any complications that is related to diabetes. So whenever the diabetes is diagnosed very late, as I told, they are more prone for developing many complications, either microvascular or macrovascular complications. That will be related to diabetes. So it is very much necessary to initiate the family members to diagnose or screen for diabetes in the earliest stages of to prevent the complications. That is very much necessary in the diabetic management because diabetic management is nowadays becoming very popular because of maintaining only the complications that is related to diabetes. That is very much important managing diabetes because many trials like UKPDS trials, DCT trials, all everything showed that the importance of treating the diabetes and bringing down the blood sugar level can come down the complications that is either a microvascular or macrovascular complications. So that is why we should encourage the family members to regularly screen for the diabetes, either
Is it
pre-diabetes
difficult?
stage.
Yeah. If we begin telling our patients and their family members, so
Yes,
let us say you are saying 50 patients, 100 patients a day, they are
yes, sir.
accompanied by 50 or 100 family members. If we
Yes, sir.
tell them, do they listen or do they argue with you? What is your experience, sir, in your OPD?
So normally, first initially they'll be very much less hesitant sir, to do any blood test because they have very much fear of about any injection or anything. But we'll counsel the patient, sir. That is
Yeah.
the basic thing about the complications that is related to hyperglycemia or the risk of hypoglycemia. Also, sometimes patient will be. So first thing will be counseling the patients is very important, sir. About the scenario, clinical scenario about reality that is related to hyperglycemia, sir. Then you will counsel. Then they'll engage the patient to do any
Then they
testing.
listen.
Like this. So
In
counseling
English,
also is very important.
Yeah. In English, Dr. Senthil Kumar, we have this proverb. A stitch in time saves nine. And then
Yes,
there is another proverb, penny wise, pound foolish. So are there
yes,
any
sir.
Tamil equivalents for these proverbs? Because if we can use these proverbs in Tamil, then we can encourage our patients to check their glucose before it becomes too late.
Yes, sir. So that is Varmun Kapam is very important, sir. Varmun Kapam means it is better than to treat the condition, better than to prevent the complications, sir. That is called Varmun
Yeah.
Kapam. Varmun
Okay.
Kapam.
So,
So
sir,
that is very
very
important.
good.
Yes,
Very
sir.
good practice, and thank you for sharing this with us, because this
Yes,
will work not only in Pondicherry and Tamil Nadu but across the
yes,
country.
yes,
And
sir.
the point that Dr. Senthil Kumar sir is trying to make is that if you are able to speak with your patient in a language
Yes,
that they understand,
yes, sir.
they will actually listen. And then
Okay.
you don't have to wait until complicated diabetes. You can catch them
Yes,
at the stage of diabetes or pre-diabetes and help them.
yeah, please.
Dr. Senthil Kumar, I tried very hard to learn Tamil, and my brother
Yes,
lived in Chennai for 10 years. His daughters learned, I
yes.
could not learn. But
It's a
a little
little
bit
bit
of
difficult,
Tamil
sir.
I know, and that is from the
Yes,
classic book Thirukural. So there is
yes, sir.
something known as quadruple of Thiruvalluvar,
Yes, yes,
which
sir.
means
Thiruvallur.
four angles of Sir Valluvar. And Thiruvalluvar or Sir Valluvar is the person who wrote the Thirukural.
Yes, sir.
What he
Thiruvallur.
says in verse 950 is, for addressing disease, for ensuring health, four things have to be in place.
Yes, sir.
One is the doctor, the
Yes, sir.
second is the patient, the
Yes, sir.
third is the drug, and the fourth is the attendant or caregiver or public.
Yes,
So
sir.
basically, what Thiruvalluvar taught us so many thousands of years ago through his quadruple was that as a doctor, you have to be good at your work. So Dr. Senthil Kumar is good at his
Yes, sir.
work, and all of us who are logged in, we are also trying our best. You have to use the best drugs. So we have
Yes,
our colleagues in pharma industry who give us very good quality drugs at very economical rates. We should thank them actually for
yes,
creating economical drugs for India. Then, so the drug, the doctor, that is in our hands. But you also have to educate the patient and the public at large. So if you
yes,
can do that through these proverbs, then your battle is won. And then you can move from undiagnosed to diagnosed and from
yes.
uncontrolled to controlled.
To control.
Sir, one more question. And this
Yes,
is that when the person is diagnosed to have diabetes, we start treatment. Sometimes
yes,
we start with monotherapy and sometimes we start with dual therapy.
yes, sir.
How often does this work? And how often does this not work in your OPD? How frequently do you have to intensify to triple oral therapy in your clinic?
Yes, sir. Because basically, as you all know, sir, diabetes itself is a progressively destruction of the pancreatic beta cells function. When now the patient is blood sugar is well controlled with the monotherapy at the initial stage, they fail to respond to the monotherapy, sir, during the later stage. Because this was very well mentioned by the UK-based trial also, sir. So monotherapy mostly fails to achieve a targeted level of HbA1c within 3 years of after starting monotherapy. So most of the patient may land up with a combination therapy, sir. Either a dual combination therapy or triple combination therapy.
Triple.
Triple combination therapy. So ultimately, final stage, the patient may land up with the insulin therapy, sir. Suppose the blood sugar is not controlled with even a fixed dose combination therapy of either a dual combination or triple combination therapy. So most of the patients, it is better to start the intensified therapy earlier in
Yeah.
intensified therapy to control the diabetic complications. That is very much important, sir. So
So
because
this
sometimes
other,
patient may not be able to tolerate that higher dose of
right.
monotherapy. So that's why
Yeah.
we should use a fixed dose combination of combination therapy, sir, to reduce the side effects also, sir. The higher dose of monotherapy drugs.
That is also important because when you
Yes,
use multiple drugs, you can give them
yes,
in lower dose. So the
yes,
safety
lower
and
dose.
tolerability is better.
Yes, sir.
Sir, one question. This is the last question. This says
Yes, sir.
that if I start triple oral therapy, patient came to me with HbA1c of maybe 9.5 or 10. He has
Okay,
never
sir.
taken any treatment in the past. If
Okay,
I
sir.
start triple oral therapy, is it necessary that I will have to continue on triple oral therapy throughout? Or after a few weeks, can I de-escalate? Can I reduce the dosage?
So, because it depends upon the patient, sir. Suppose the patient's blood sugar, generally the what's saying is, suppose the blood sugar is HbA1c level is more than 9 minutes, the guidelines say that better to start a fixed dose combination therapy of either a dual combination therapy or triple combination therapy or straight away insulin therapy also, sir. Suppose the patient is responding to a dual combination therapy, a fixed dose combination of dual combination or triple combination therapy, either we can escalate the therapy or bring down the therapy, sir, depending upon the therapy.
So that also we should tell our patients that
Yes, sir.
sometimes we treat diabetes as a chronic disease. So when
Yes,
you're
sir.
treating diabetes as a chronic disease, gradually there will be escalation of
Yes, sir.
number of drugs and dosage. But
Yes, sir.
many times in India, we treat as an acute disease. Acute
Yes, sir.
means patient come in with acute or subacute complications. You
Yes.
do aggressive therapy, with insulin or drugs. After
Yes.
4 or 6 weeks, that acute thing disappears. Whatever infection there was, whatever
Yes.
stress there was at home, that becomes okay, and then you can reduce the doses also, or
Yes,
reduce the
I
number
got it,
of
sir.
drugs. In Pondicherry, sir, how
Yes, sir.
in your OPD, let us say you saw X number of patients today. How
Yes,
many
sir.
came in for chronic follow-up as chronic patients, well-behaved patients just coming to show you your reports? And
Yes,
how
sir.
many came as acute patients with symptoms? So
Sir.
what was the percentage in your OPD today, sir?
So because acute symptom patients is very much lesser, sir, as compared to the
Hmm.
chronic patients, sir. Because mostly sometimes patient may land up with acute complications. Sometimes the patient be like a type 1 diabetes, they may land up with a severe infection or like a ketoacidosis, sir. Sometimes even in the
Hmm.
clinic setup also, sir, both in Pondicherry
Yeah,
and Dindivanam, sir. So in that case,
right.
I'll just refer the case, sir, for the better reason. Suppose a patient is coming with
Control.
acute complication that is related to diabetes, sir. But majority of the
Right.
patient comes with for chronic follow-up, sir, for diabetes, for follow-up cases.
Thank you, sir. Well said. And this also, we would like to reinforce that it depends upon where you are working in the country.
Yes, sir.
It doesn't depend upon the state. It actually depends on the part of the state.
Yes,
So
sir.
if you are in an undeveloped area where there is no other diabetologist, you will be handling more of acute symptoms,
Yes, sir.
acute diabetes. But
Yes,
if
sir.
you are in a developed state, like Pondicherry is a developed and educated UT, then you will have more of chronic patients. So
Yes.
be aware of this and do not feel shy in sharing your experiences with other people across the country. Sir, there is one more question, and this is asking for a translation in Tamil, if you allow. So
Okay, sir.
the question is, we have learned the quadruple of Thiruvalluvar.
Yes, sir.
We have also learned Tamil proverb that stitch in time saves nine. Preventing disease is better than curing complications.
Yes, sir. That is.
Please give us a translation for 1 plus 1 is equal to 11. It is not equal to 2 in Tamil, please.
Oh,
That is the
one plus
question.
one. Sir,
Is equal to
one plus
11.
one.
It is not equal to 2. Yeah.
Sir, the one plus one. அது ரெண்டுமே வந்து is not the two. That is இரண்டு. That is equal to 11, sir. One plus one. That
11.
is 1 plus 1. That is equal to 11, sir. 11.
11.
So
And I
11.
think that is the basic ethos of 4D.
Yes. Okay, sir.
When we work together, we strengthen each other. And 1
Yes.
plus 1, like Dr. Senthil Kumar sir is with us, 1 plus 1 is not 2, it becomes 11 because we learn
11.
from each other. We learn from each other's expertise and education. And we are able to strengthen ourselves when we go back to our clinics to practice diabetes. So today, India may be undiagnosed and it may be uncontrolled. But
Yes, sir.
tomorrow, I am sure we will be able to diagnose and control diabetes in a timely manner. Thank you, everybody, for having logged in with us. And a special thanks to Dr. Senthil Kumar for
Thank
sparing
you very
time
much, sir.
for us today. Thank you, sir,
Thank you
so
very much,
much.
sir.
We are obliged
Thank
to
you very
you.
much.